this integrating and strengthening drug response to drugs and other problems into health sector, because for very many years, a person responsible for medical services in jail was an officer, and the whole hierarchy and decision making was a little bit different. So now, for the past 5 to 2 years, we have a lot of different measures that we are trying to implement in Lithuania. So our prison context, as I said, is a little bit different from Norway. We have quite high imprisonment numbers. As you see, we're among the countries which imprison the most. We have very long sentences, quite disproportionately long sentences, but this is part of our legal system. And we have very few reduced sentences. So that means that even if you are doing quite well, and if you are applying dynamic principles, and if you are improving in certain ways, probably your sentence will not be reduced. It is changing now. We have a new legal framework, but it's still quite long sentences without leaving the jail. We do have inadequate jail infrastructure. We don't have similar conditions as it was shown. High levels of stigma and high availability of drugs in jail. And in that, we do collaborate a lot. And some of the collaborations are very pleasant and interactive and involving. Others can be quite trying, like with the European Committee for the Prevention of Torture and Human Degrading Treatment or Punishments, CPT, when they come to visit, and they do have comments and they do have questions. It is quite difficult, but it really makes these kind of cooperations really makes improvements faster. It creates some of the political will and helps to attract resources to specific problem solving. And we do get involved in all of the collaborative activities that we can. Again, all these contributions, they have helped to improve the response towards drug in Lithuanian prisons. And the recent focus is increased focus on treatment. Actually, probably for the first time in this for a long period, it's shifting from exclusively punitive approach, whereas you always punish, whereas we have to create new opportunities for treatment. There is much more focus on the evidence-based treatments, especially substitution treatment. It has been relatively recently introduced and has now really, we are approximately 1/3 of substitution treatment in Lithuania is done in prisons. So it has become an important part of treatment access. We have really improved access to infectious disease treatment. That means that for the HIV and hepatitis C treatment, people are also getting subsidized treatment, which was not available before. There is a very strong focus and a new focus, and mostly through working with the Norwegian dynamic model, was in reducing violence. Not only specific focus on drugs, but through reducing violence, and also improved outreach, supported release, and new prevention initiatives focusing on preventing prescription drug abuse, which is building a big problem in Lithuania as well. So again, what has it brought us? Basically, we've been building trust and reducing tension with a model that you heard, and it has really helped to create new units for people who tend to reoffend often, and that is part of reoffending is also drug abuse. So these specialized units have been really now an important part of Lithuanian jails, and we are planning new units for that. There is new and important focus on environmental factors and procedures. So, for example, video registration of how officers and how inmates behave has been mandatory since 2021. So it is also an important both control, monitoring factor, but it also helps quite a lot to, again, change behaviors, train people, improve communication. There is a very, very strong emphasis on staff training. What you've heard from the Norwegian model, also our officers are being trained according to the similar model. It is being introduced into the basic course for all the jail officers, so that more people who are joining the force can actually work based on these principles. Again, there are other quite innovative approaches, such as safe letter, for example, basically strengthening supply side controls, because drugs have very many ways into jail through very different modes, and one of those to prevent that is copying of the letters where there are additional risks. We've been working quite collaboratively with the Retox and other networks for early warning system for the NPS, and as of last year, introduced new different pilot measures for reducing abuse of psychotropic drugs that are prescribed, and they're quite also frequent in jails. And it's not an easy thing, and it requires not only a medical response, but it requires a multidisciplinary cooperation between officers and different staff, including also medical staff. Again, we think that in overall response to drugs, health response is very important. So not only psychiatric services, which we have managed to increase 3 times, and as I said, substitution treatment has increased quite dramatically in jails, but also improved access to normal medical services, increased access to even surgeries, long-term treatment that are necessary outside jail and inside. So we have an in-house and generic services combined. As you see, we have received quite positive some of the positive assessments. So just last year, we had a CPT visit, and they have mentioned that there are quite important changes and improvements of the reintegration processes, and also the drop in the numbers of prisoners. But we do still have a lot of things to improve and to do. And again, just would like to say that our focus through the collaborative effort through different organizations with funding from EEA and Norwegian grants, as well as collaboration with other networks, we have achieved increased access to addiction treatment as a medical procedure, increase in staff numbers who are trained in different psychosocial interventions. Also, we are creating a collaborative framework for multidisciplinary drug prevention measures, especially focused on prescription drugs. And we hope that this event will also kind of strengthen and refocus that we can do quite a lot, learning from different best practices, sometimes picking up just parts of these best practices. Sometimes all of it is not possible to move, but things you learn in the different countries from different interventions, training of the staff, even technical and technological measures are actually possible to be transferred into countries which have much less money. And used creatively, they can have an impact. So we do hope that this will increase the scope and the quality of international collaboration in the future. Thank you.